Okay, you have completed your metabolic test with me. It was nice meeting with you. I wanted to throw this video on here just to go ahead and clarify how you make sense of the workout program I have sent you. I have sent you an email with a PDF attachment to it that starts with the first page looking like this. That first page has these zones on it: zone 1, zone 2, zone 3, zone 4, which we talked about. Remember that zone 1 is the zone that you are maybe not burning the most amount of calories, but you are burning a lot of fat. So you will become very familiar with those zones as you work your way through this 12-week program. Every week has 2 pages that show you what you're going to be doing. One page is very colorful and shows you graphically kind of what your week is going to look like. In this example, I have this client working out 5 days a week doing cardio. On some of you, you may be doing cardio 2 times a week, 3 times a week, 4 times a week, just depends on what we talked about and what your goals are. If I have a day of rest in between, you don't necessarily have to take that day of rest. You can do cardio days back to back, but of course everybody is different. Some of you may have a situation where maybe I don't want you doing cardio back to back. So if we didn't talk about it specifically and you have questions about it, please feel free to message me in the PT Distinction app. So you've got this piece of paper kind of showing you what you're going to be doing for the week, and then you've got another piece of paper that says what you're going to be doing in words, because although this is very pretty and colorful, it's very hard to read and make sense of when you're on the treadmill or elliptical or bike. So that's why we've got this other one in words that tells you what you're going to be doing. So for example, this first day, this particular person is doing 2 minutes in the low zone. So you refer back to those zones, or if you're using your Cardio Coach app, it's very easy to see what that zone 1 is. It has that nice odometer, kind of speedometer on there to kind of show you where your heart rate is. So for 2 minutes, you're going to keep that heart rate in that low zone. If you're on a treadmill, that might mean walking at a very slow pace. Maybe you can tolerate a little bit of incline. Maybe you can't. I don't know. That's why we're doing heart rate training, so it's very specific to you. After that first 2 minutes in the low zone, you're going to bring the intensity up, either by going a little bit faster on the elliptical or adding incline on the treadmill. Or maybe you decide just to go faster, or maybe you add more resistance to the elliptical. You have lots of options on how you're going to get that heart rate to go up and down, depending on what piece of equipment you're using. That's what's so nice about the heart rate training, is you can use whatever a piece of equipment you happen to like. People always ask me, what's the best piece of cardio equipment? It's the one that you like and you're going to do, okay? Now we are other reasons why I might make recommendations about other pieces of equipment, but first and foremost, it's whichever one you're going to use and hopefully enjoy. So that's just a little bit on reading your cardio program. Again, this was emailed to you. It's a PDF attachment and an email that I sent to you shortly after your test. So good luck, have fun.